Okay. First, I'd like to state that our argument is that the United States as a nation should adopt Oregon's policy of physician-assisted suicide and not specifically just California. The opponents stated that palliative care is more acceptable and is a better option for patients. But palliative care includes the use of continuous deep sedation, which is where they administer morphine or other narcotics every 4 hours or so to keep the person asleep. This results in a loss of consciousness and a loss of control on the patient's part. This is a non-voluntary. Doctors prescribe this, and caregivers or nurses administer the medication. Continuous deep sedation is a deprivation of liberty because it is a significant loss to your freedom of choice. And therefore, palliative care is not adequate. Physician-assisted suicide is an adequate alternative to continuous deep sedation because it allows the patient to decide their own treatment. Another example of palliative care is removal from life support or refusing life-saving medical treatment are all morally acceptable because they are indirect. Physician-assisted suicide is also indirect. The physician does not give the patient directly, does not inject it. The patient takes it themselves. It's self-administered. Anna Marie used the Code of Ethics argument that euthanasia is against the Hippocratic Oath. We are not arguing for euthanasia. We are completely against it. Euthanasia is actively killing of another person. We are advocating for physician-assisted suicide, which is the prescription of lethal drugs that are self-administered by the patient. Physician-assisted suicide that does not imply an entitlement to suicide assistance from anyone. It means that doctors and care can deny it, but they still have to offer it. The right to bodily integrity allows one to avoid invasive treatment, even if that treatment would assuredly be effective in prolonging life. And if that patient's wish is for an earlier death, to hasten death and reduce pain, that treatment is not permitted. An absolute and complete prohibition of physician-assisted suicide limits individual liberties. And according to Dr. Timothy Quill, professor of medicine, psychiatric and medical humanities at the University of Rochester School of Medicine and Dentistry, he's also the director of the Center for Ethics and Humanities in Palliative Care, and a board-certified palliative care consultant, a board member and president of the American Academy of Hospice and Palliative Care. He states that physician-assisted death is the only last resort option currently governed by a tact policy that the practice will remain technically illegal but covertly tolerated as long as the act is not officially reported. If it becomes legal, it will have more standards and regulations, meaning less abuse.